Hi, I'm Cathy O'Malley. I'm from the Ministry of Health. We're here today for this workshop to talk about alliancing. Why would we form an alliance? Why have we suggested that rural alliancing would be a good idea? The rural sector is extremely important to New Zealand. It's part of our economic fabric. It's part of the way we live our lives here in this country. Rural general practice and rural health services have certainly faced some challenges in recent times, as has many parts of the rural sector. We've tried to fix that from the centre. We've had many years of conversations about the rural health funding. We've always come up against the sort of grey areas that any rules don't address. So as we've tried to create the balance between national and local service development, we've actually decided that the local rural sector are probably best placed to have the discussion about how rural services should look and feel. So how is all this going to work? How is an alliance going to actually roll out in any particular rural community? Well, first of all, I suppose you need to ask the question of, when I go to work in the morning in my service, in my general practice or in my pharmacy, can I do this job by myself? Who do I most need to help me? Who is the other practitioner or the other service just down the road or in the next room who's really important, and who do I depend on to get the best result for my patients? They're the people that first of all we need to bring into an alliance together. If you're a GP sitting in your practice, possibly you would say the practice nurse is the person that you most depend on to get the best result for your patient. You probably have quite a lot of interface with the pharmacist. Certainly your patient will have plenty of interface with the pharmacist. So maybe a practice nurse, a GP and a pharmacist might be good to bring in to the alliance. The most important point I'm trying to get across here is that the way the alliance is formed needs to depend on what the problem is you're trying to solve. What's the scope of the conversation that you want to have? Who's really important to be in the room to, in the end, get the best result? That's the basis of the alliance. There are a whole pile of rules and contracts and things that can sit around this in the bigger picture or sitting in behind. But at the end of the day, what's the problem you're trying to fix? What's the frustration that you have every day when you come to work? What are the things that you've always wished you could solve? And who are the people that, in an ideal world, you would have in the room to have the conversation to come up with the best solution? Well, I suppose, what does success look like? How will you know if you're making a difference? Well, first of all, you needed to know in the first place what the problem was you were trying to solve. When you've really decided what your focus is, one of the first steps will be to answer that question for yourself. How will I know when I've got there? How will I know when it's getting better? Data might make a difference. If you can measure what you're doing, that would be good. But sometimes it's also about how the patients feel. You might ask the patients whether it's getting better, or the people in the community, or the pharmacists down the road, or the District Health Board, who are trying to fund and plan the services for the community. So data is important, but so is perception. So is how does it feel? Am I going home at the end of the day feeling like I've achieved more than I did before? So there's some abstract or some subtle measurement that you can bring into this as well. So why should you get involved in this? Why should anyone get involved in this? Well, if it's all great and there's nothing to solve or nothing to change and you don't have any frustration in your work, well, keep on doing what you've always done. If you think that the resources are going to keep flowing, if you think that technology is not going to make any difference, if you think that your service is sustainable and you don't need any help, then just keep on doing what you've always done. But I'm not sure that that's the reality for any of us living in this country or in the world, actually. We need to think about the dynamic that's going on around us. And we need to think of the next generation. We need to think about, why are we coming to work? It's a privilege to work in this health sector. It's a privilege to receive the level of government funding that comes into our sector. Are we, as people responsible for that, making the most of those resources? There are a whole pile of reasons I think you need to get involved. Not the least of which is, in Wellington we don't have all the answers. We need you to get involved, to come up with a better solution.